Ballad Health Chief Infection Prevention Officer Jamie Swift joins us to reveal what these numbers mean. Jamie, thank you for being with us today.
Thank you.
Thank you so much. 18% positivity rate. I want to ask you real quickly, are we talking like 1 in 4 people that get tested now are positive? Is that another way of seeing that almost 20% positivity rate?
Yeah, at almost 20%. That's
1 in 5,
what we're
I
seeing,
guess.
and that's extreme. Yeah, I mean, it's extremely concerning.
That's very high, according to all standards, right? We want to talk about.
Absolutely. I mean, we don't.
Go ahead.
We do not want to see positivity rate that high at all.
Yeah. Thank you. And I appreciate the perspective on that, because to me 18% is like, well, what's that mean? You know, but I appreciate that. Let's talk about the record day for Ballad in terms of hospitalizations. What kind of strain is this putting on your health system tonight?
You know, it's a real strain, and it's a strain that we are all concerned about. You know, we're continuing to have discussions of what things we're going to have to cut and shift and move around in order to provide the care that we have to provide to our COVID patients. It's extremely concerning. It's concerning for us, and it's concerning for the community.
We're hearing some states saying we have no available beds. Is there a danger of running out of beds?
You know, I think it's what we've always talked about. We've got the physical space. We just don't have an unlimited number of nurses and providers. And so it becomes that human element issue. And I think most hospitals are in that same place. They may have physical space, but we're all going to run out of the staff to take care of those patients.
I see what you mean. It's not just about the bed. It's about the people and the to take care of the person in that bed, right?
Yes.
Let's talk about why. What do you think is attributed to, or could be attributed to, the cause for this spike in cases that's leading to the spike in hospitalizations?
I think we're seeing, we are seeing just widespread transmission. We know we have the highest level of virus burden that we've ever had in this community. And unfortunately, I'm not seeing people respond to that. And I don't know if it's pandemic fatigue and they just want this to be over, but we cannot do the things that we've been doing with this burden of virus in the community. We all have to make changes in our day-to-day behavior, and we have to do it now.
Which leads me to Thanksgiving and planning that I think so many people are doing right now, hearing the expert advice that they do need to make changes. So what's your definition of a safe Thanksgiving celebration for family and friends?
The only way to do a safe Thanksgiving at this point is to have it within your immediate household. And I know that's hard. I know Thanksgiving is about family. My family personally, we have family from out of state. We get together every Thanksgiving, and we've canceled those plans. And so it will be me and my husband and my 2 kids, and we'll Zoom everybody else in, and we'll do it virtually. But we can't go beyond that this year.
So some are talking about testing their way to a safe Thanksgiving. Get everyone tested, make sure everybody's clear, get the negative results, and then it's Thanksgiving on. What's your thought on that?
The only way that would work would be if you quarantined. And so, a negative test the day before Thanksgiving may or may not give you any assurances that you're not actually infectious and may not know it yet. So really the only way to do that was to do it 14 days before Thanksgiving, get that negative test, and then completely quarantine, which means no work, no going out, no going to the stores, a true quarantine.
And we're kind of in that window now, aren't we? I mean, we're kind of into the window. If you do when you say quarantine, would you be recommending 14 days prior to the Thanksgiving holiday?
Yeah, and that's what's recommended. Certainly if you get tested tomorrow and quarantine, it lowers your risk, but it doesn't take it down to 0, because you may very well have been exposed today and turn positive by Thanksgiving and not know it.
And that's pretty tough if you got to go to work, right? Which so many are doing and have to do. Pretty hard to truly quarantine, right?
Yeah, and I think that's why really the ultimate recommendation is just to celebrate with your immediate family, those that you live with, and try to talk virtually to your family, and just realize this is one Thanksgiving, and we're making the sacrifice this year so that we can spend next Thanksgiving with those that we love.
Half of the area that Ballad Health serves is in the state of Virginia, where we just saw a pretty big clampdown in terms of restrictions coming. Tennessee, not so much. Are you monitoring that? Are you cheering on those restrictions as somebody who works in infectious disease control? And to those who are in Tennessee and aren't dealing with the restrictions, what's your message to them tonight?
I absolutely am cheering those restrictions on. As an infection prevention coordinator, we know that those are the tools that we have right now to slow things down. And all I can ask of anybody who's not in those states, or who's in Tennessee and there's not mandates, at this point we're asking our community, you shouldn't have to be mandated. We're asking you to please just do the right thing. Limit your exposures, limit your travel, limit your going out, and just try to help us slow this down.
Jamie Swift with Ballad Health, our best to you and the whole team there providing care tonight. Thank you very much.
Thank you.